Mike Costa back with you here on AM 600 Kogo courtside in a very loud and boisterous Viejas Arena. The voice of San Diego State University, Ted Light, will have the call coming up in about 18 minutes. We are happy once again to be joined by Dr. Carol Salem. She's the medical director of Scripps Minimally Invasive Robotic Surgery Program. She's a urologic cancer surgeon who specializes in the treatment of prostate cancer. Doctor, so glad to have you back.
Thanks so much. We're super glad to be back.
The timeout for your health partnership between Scripps and San Diego State has that Aztecs personal connection. Head men's basketball coach Steve Fisher, a patient of yours, so you've grown to know the coach up close and personal quite well over the last few years.
That's right. We sure are close to him. As you know, he was diagnosed with prostate cancer.
Right.
About a year and a half ago now. So he came over to our Scripps hospital, and we had a long conversation with him, and he ended up choosing a surgical approach, what we call robotic surgery, and has done great, as you can see. He's out on the court. He's been out on the court since a couple of weeks out from surgery, and from a cancer perspective, he's also done quite well. So he's really been a good role model for men to look at.
I'm sure Coach Fisher, just like most men, had questions about prostate cancer when you two initially met. What are some of the answers to the most common asked questions? I'm sure there are fears and concerns, just like anything when it comes to that word cancer, especially with men and prostate cancer.
Right. Well, the questions get so extensive that our initial visit is typically an hour and a half to 2 hours long.
Wow.
That's how much information we need to go over. And, with the internet nowadays, they just get inundated with the information that's out there, and some of it quite skewed based on who's writing it. So
sure.
We really like to spend a lot of time with them, helping them to mull all of that information and sort of narrow it down to their personal situation, whether it be surgery or radiation or cryosurgery or no treatment at all, or whether or not they're not a candidate for treatment. So it's really an extensive conversation. I think it's important for most men to realize that, the information can be skewed at what they're reading, and it's important to look at the source of what they're reading, and, really meet and talk with the doctors and the different types of doctors in order to get a good, well-rounded view of what's available.
The benefits sound great, but what about people that have not been diagnosed with prostate cancer? What type of symptoms? I'm a man in my 40s now. What do I look for if I'm concerned about it?
Right. The really important thing for you to know is there are no symptoms of early stage curable prostate cancer.
Okay.
What brings you guys in typically are the urination symptoms.
Gotcha.
But that's not from prostate cancer. That's just from benign growth of the prostate. And it gets you guys into the doctors, and you hadn't been to the doctor your whole life at that point. So it's a good time for us to screen you at that point for prostate cancer, but it really has nothing to do with prostate cancer at that point. So what men need to know is that these prostate cancer screening efforts that are going on really throughout the country are important for them. You got to catch it before you even know you have it. And that's true for any cancer. We really want to try to catch them before you have a symptom from it. And we're blessed to have this PSA blood test. It does come with some ambiguity in certain cases, but it is helpful to have an annual PSA to look at. It gives us a velocity of the PSA to assess, and the rectal exam. And I think most men are fearful of that rectal exam. It's really quite brief.
Since we are talking about reminding people to take time out for their health, what are your Scripps tips when it comes to the prevention, the early detection of prostate cancer?
Right. Well, our big Scripps tip is that you really should visit with your primary care physician on an annual basis. And we think now starting from age 40 would be a good idea. The American Urologic Association has come out with that. And if the initial PSA is quite low, that can be done every couple of years. But if it's worrisome, it should be looked into or done annually. There are certain risk factors for men to be aware of to start getting checked earlier, and that is if your dad or your brother or your uncle had it
Right.
at an early age, then you should be concerned that you might get it. And also African American men, as you know, are at high risk for prostate cancer. It is the #1 cancer diagnosed in this country today for men, and it's just really important that we figure out who has it before, you know, the death rate continues as it is. It's the #2 cancer killer in this country.
Wow.
Which is quite unfortunate. Now, while the government is trying to calm down our screening efforts, we'd like to tell people we want to gear them up. We
Sure.
want to increase our screening efforts and get better at prostate cancer screening and try to learn someday how to hone in on which patients really need to be treated and who can be left alone. And we're getting closer to that. Our scientists in the community and at the universities are working on that. And that doesn't mean we should stop screening. It means we need to get better at it.
Always great to see you. The Aztecs going to win tonight?
Oh, yeah.
Absolutely.
Oh,
Dr.
yeah.
Salem, again, thank you for your time.
Thank you so much.
That's Dr. Carol Salem with Scripps. For more information on how you can take time out for your health, visit San Diego State's website, goaztecs.com or scripps.org. The Aztecs trying to get win number 21 tonight. When we get back, the voice of San Diego State University, Ted Leitner, standing by with head coach Steve Fisher.